Well, my name is Jason Bully. I'm the Senior Managing Vice President in the Technology and Operations Division here at BWF Zuri. I'm glad you could join us today, and I am joined by a stellar panel, which I will introduce individually here in a moment. That's joining us from both MaineHealth and Intermountain, and they've both been fantastic clients to work with who have gone through this topic today of advancement and transition, talking about some of the opportunities and obstacles that we encounter during health system mergers and database consolidation. My plan today is to first bring up the slides. Thank you for the chat there. And I have about just a handful of slides to go through, and I'm going to try to keep that under 10 minutes. And then we'll bring down the slides and get into the panel discussion. Um, for those that know me, I like to keep this fairly casual. But just so you know, in case things get a little bit of clunky in stellar planning, I'm joining you today from a client site on the world's smallest laptop screen and juggling several, try to trade things in and out as we go. So forgive me if it's a little slow on the transition. Um, and if you have any questions, Lauren's from BWF Missouri is going to be helping me monitor those in the chat. She may interject, but we may save some of those to the end there, and you also get a recording. So joining me today, I'm very excited to have Courtney. I'm not going to butcher your last name. Courtney, help me out here.
Bolanias.
Thank you. I always get that wrong. Courtney is the Philanthropy, Analytics, and Strategic Operations um, position at MaineHealth, and along with Nina Emmy, who's the Senior Director of Philanthropy Services. We also have Nancy Gregovich from Intermountain Foundation, she is the Vice President of Foundation Operations, and Brian Spratt, who is the Director of Philanthropy Systems. And hopefully, you all had a chance to check out their stellar backgrounds in when you signed up for the webinar. So again, very pleased that you could be with us today, and thank you so much for your time. We're going to talk a little bit today about why system integration is accelerating, organizational operational realities, data governance, and CRM considerations, and then lessons learned and trade-offs. But the goal today is to make this feel like a conversation and focus again mostly on the participants on the call, so we can learn from their real-world experiences, and you have an opportunity to ask questions and learn from them as well. So, a few slides just to start us off with. This is an interesting time to have a webinar because for those of you that are familiar with BWF or Zuri, you may have gotten an email or seen a press release about our acquisition and merger activities this week. So, I've had 11 years of saying BWF. Well, first it was Benzoyl Flesher, then BWF, and now it's BWF Zuri. So it's going to take a while for me to get used to. But we have, I'm not going to read this screen to you, but the combined forces there are a value add, and we're hoping to continue serving our clients well, along with the growth that combining with Zuri offers us to take us into the next era of fundraising growth and operations support as well. So I got a couple slides on that. That grows our company to serving 450 clients. We're now almost 180 team members as a company. We have deep specialization in many areas. We remain a company that's solely focused on nonprofit and the business that they do and the money that they raise. We continue to have a global outreach, and that's expanded with Zuri. And going forward, you'll hear us talk about BWF Zuri as one combined company. And then, if you're not familiar with BWF Zuri, our main verticals are campaign and fundraising strategy, engagement and donor experience, fundraising operations, which is the team that I'm on, and we're talking about today, as well as technology implementation and optimization. And then finally, on the company side, I picked out a few service areas that we that we focus on at BWF Zuri that, frankly, I think because of our history of fundraising strategy, I think are things that people don't often know that we do. But we've worked on with both MaineHealth and Intermountain, and those include technology platform selection and implementation services, data strategy assessments, ecosystem mapping and road mapping, and enterprise reporting and warehouse services are all things that we do as a company, which I often think is some of the best kept secrets in the industry. So our team is stellar. But let's get back to the topic at hand, which is the healthcare mergers. And why are we talking about this now? We've had a great increase in merger and affiliation activity, which, if you're joining us from the healthcare perspective, I probably don't need to tell you about. Expanding multi-foundation structures. Um, and with that, increased pressure on enterprise reporting and governance, which is top of mind for all of our healthcare clients, and the unified donor journey, as well as just bringing software in alignment and up to date as part of those activities. So why does this matter now? Well, if you're in healthcare, I probably don't need to tell you many of these stats, but nearly 7 in 10 community hospitals are now part of a larger healthcare system just over the last few years. The multi-hospital uh, systems, the bed capacity shifted from 58 to 81% over that period of 2020, which indicates a lot of merger activity. And then last year, nearly a third of hospital transactions in 2024 involved financially stressed organizations, and two-thirds included divestiture activity. And all of that just goes to show why we're seeing a lot of activity around hospital mergers and consolidations, which leads to the kind of issues that we're going to talk about today. When you start to look under the hood of bringing those organizations together, even at the foundation level, it has a lot of increased complications associated with it. So when we talk about these issues, they're not just technical. There are some technical questions that we'll get into today, but we want to consider governance, and that can mean everything from data governance all the way up to organizational government, like who's owning decisions, how is our policies going to be harmonized and aligned, and how do priorities get made. We need to, of course, look at the operational components, staff alignment, business process alignment, things such as policy again, with how are we going to manage prospects and how are we going to train and handle change management within the organization. And then, of course, if there is the technical part of it, many of the organizations, including MaineHealth and Intermountain, had some database mergers as part of that, as well as the broader technology ecosystem, bringing organizations into harmony, or platforms into harmony. With that comes things like duplicate management, especially if they're in the same, regional markets, and that reporting and that we mentioned earlier. And then we get down to the nitty-gritty with things like security and access models as well. So we can go very deep on this, but we're going to keep this pretty high level this morning. In general, when we talk centralization versus local flexibility, we have some trade-offs that we're usually looking at. We can move very fast, but if we do that, we usually sacrifice precision. And MaineHealth had to, for various reasons, move very fast on their consolidation, and they can speak to that today. Standardization versus organizational activity. Some depending on how the organization is organized, especially if they're regionally separated, you want to keep that identity, but then you also want to take advantage of standardizing as much operational work as possible from an efficiency standard. And then, you also want, depending on how the needs are laid out, foundations need to be able to work autonomously and report autonomously, but they also need to roll up to a larger enterprise level. And how can we accomplish all of those needs are things that we're talking about today. Okay, I'm going to bring down the slideshow and turn to our panel discussion, if you'll bear with me just a moment. And we're going to start the conversation kind of broad, and then and I'm going to ask our participants to kind of we talked about this before we logged on, but we're going to kind of hopefully get a perspective from everybody on the call as we go along. But what I'd like to start off with is asking, what were the circumstances in your particular organizations? And this will give you an opportunity to kind of introduce, where Maine Health is and where Intermountain Health is and some of the unique aspects of your organization. What were some of the things that drove the consolidation efforts at your organization? And that'll help us understand, what you look like and what challenges were became apparent first for you. I'm gonna ask I'm gonna ask Maine Health to start us off.
Yeah, happy to dive in. So, MaineHealth serves the state of Maine and also the state of New Hampshire. We're a large organization that used to be many different hospitals in mostly rural settings, but also in urban settings. We have a large trauma one center in the largest city in Maine, which is Portland, and Maine Medical Center. And MaineHealth is going through this process at large, harmonizing. And philanthropy is one sliver of that piece of the pie. So this is happening kind of across our organization and in every aspect over the last several years. MaineHealth Philanthropy started moving in that direction internally and had a new CDO come in who's incredible, our CDO, Aaron Brown, about 18 months ago. And Aaron said, I think we can look at not only migrating these databases, but our teams in a much more intentional way, which is part of the reason why we brought in the BWF Zuri team to help us kind of make an evaluation where we are. And so lucky to have my colleague Courtney with me today, who kind of led that evaluation effort and is also project managing this integration. So really took the time over several months to go, how can we do this? Take 9 teams that were small fundraising shops that aren't just combining their data, but also going from a small shop way of fundraising to now we're a mid-sized to large shop. So how do we scale our work, not just the database? And how do we do that with intention? And really needed to take a step back and evaluate where we were. And so that process happened last summer. And now we've, like Jason mentioned, really gone into warp speed and consolidated 10 databases in the course of this fiscal year. And basically, Courtney, what do you think? 5 months, maybe?
I'd say 5. Yeah.
5 months. So, and to that question of speed versus precision, we definitely pick speed on the MaineHealth side because all change is going to be iterative. So you've just got to jump in and make those changes and work through that process. But that's a little bit of the context of how we got here.
Great. Thank you so much. And Nancy, you wanna address that same question on how you got here?
Sure. And I first want to just say applause, Nina and Courtney, that you're still smiling after a 5-month database integration. It wouldn't matter how many databases you brought together in 5 months. That's quite an accomplishment. So congratulations. Intermountain Foundation's journey around integration actually started more than a dozen years ago when Legacy Intermountain Health had 16 separate foundations across the state of Utah. And we undertook at that point in time to dissolve all 16 foundations in lieu of one Intermountain Foundation. And that came with a 7 database integration. So that's Legacy Intermountain Health Foundation. In April of 2022, Intermountain Health announced an integration with a health system based in Colorado called SCL Health. We refer to that now as Legacy SCL Health because we have come together as one system, and we are now branded Intermountain Health. And we have gone through a complete rebranding of those 2 legacy organizations, and we have begun to migrate into Nevada as well. So we are currently in 6 states. We're the 6th largest health system in the country. We have more than 69,000 caregivers across those 6 states. And from a foundation perspective, Legacy Intermountain Health Foundation has come together with 9 separate SCL foundations into now one Intermountain Foundation, except for that there's a little side foundation, which is called Catholic Health Intermountain. And that is kind of runs behind the scenes. We are branded as one Intermountain Foundation, but we do have the Catholic foundations where some of the assets of 6 of the 9 legacy SCL foundations have their assets aligned and kept, even though we're behaving as one Intermountain Foundation. So our integration as to health systems began in April of 2022. Our integration of 1+9 foundations began in January of 2024. So the rest of the system, so our leadership teams, our HR teams, compliance, finance, accounting, all of our other business units, or many of our other business units, went through an integration during phase 1 or phase 2. The foundations were included in a phase 3. One of the things I'm most grateful for in being part of phase 3 is that by the time the foundations got their turn to integrate, a lot of the other business units across Intermountain had already done their integration. So one of the other things that I'm extremely grateful for is that Intermountain has an ethos. So we are an operating company. The parent company is an operating company. So from the highest levels of the organization, there is an ethos called One Intermountain. So that ethos of One Intermountain says that no matter where you go in Intermountain Health, you should have a consistent, extraordinary experience no matter where you are, when or how someone interacts with Intermountain. So you should get the same access to care, quality of care, etc. So when we started to come together as 1+9 foundations, and we began to integrate our teams and our 2 separate databases, we could point to this concept of One Intermountain, and it really was a guiding principle for us in bringing together not just our business systems, but also our culture. So we were able to integrate approximately 65 Legacy Intermountain employees with approximately 35 Legacy SCL Foundation employees into one. So we are a shared service model, and we provide most of our back office functions have been centralized, standardized, harmonized, and integrated, and we provide services now to 3 regional fundraising teams. And so that is how we got here today. At the beginning of our integration, from a governance perspective, we spent a year looking at how should we bring our fiduciary boards together from a foundation perspective. Concurrent with that, we started to look at our 2 separate databases, having learned a whole bunch from 12 years earlier on what to do. And I had the good fortune of getting approval to engage BWF. And I am so grateful to Jason. And also, I think Josh Laborde is on the call today from BWF. And also, I have to give a huge shout out to Kate and Shantae for their support in looking at our 2 different databases, and then creating the best thing ever was a roadmap, a technology roadmap into the future. And we have used that roadmap to guide our work. And then we also use that roadmap and a little red arrow on the roadmap that says data governance, which was something we had never had previously. And props to Brian and his team, several of who are on the call today, for their work in creating, not just creating standards, but documenting standards and aligning standards in advance of bringing all of the data together, and then continuing to do that work as we are bringing on other tools and applications, and as we begin to consider what our future looks like in the world of AI. So that was kind of long, Jason. I hope that is what you were looking for.
Yeah, no, that's great. I kind of want to stay on that topic and ask MaineHealth a little bit because to me, when I generalize, you're both in very different places. Like MaineHealth is like right in the middle of the fire right now, and Intermountain's a little bit more mature, a little bit further out from the centralization efforts. But so from MaineHealth perspective, like what do you think? And I'm thinking about governance in kind of a broader perspective, whether organizational, not just like specific data governance, but what are some of the decisions that you've had to make early on that have been most important, or where have you seen like the biggest pressure that you had to make some quick decisions up early and that's paid off as you've gone through this process?
Courtney is our data governance queen. So Courtney, you want to jump in there?
I think we're fortunate in the sense that data governance is new for all of our integrating healthcare communities, truly. We had SOPs and we had some productive working models that folks were working off of, but data governance has been a really critical piece, along with the excellent guidance of Kate Shante and then also Shannon Cooper, who I think is on this call, in being a unifying piece for our consolidation efforts. The analogy I've been giving to our team members is that we were all baking a chocolate cake, but some folks were in a commercial kitchen and they were using volume to measure the ingredients, and some folks were doing single servings and just kind of scooping stuff out depending on what tools they had available to them. And the sweet spot is unifying set directions and definitions together. The way that we chose to approach what we would tackle first was largely the pieces that would make us successful in a very quick turnaround for our database consolidation. So, and as we pulled those threads and started working on it, we quickly discovered that sometimes that was a different direction. And as Nina said, like very much our team was aligned with being iterative and adapting and being flexible along the way. So we started with things like campaigns, funds, and appeals. And very quickly, we realized that that also needed to be done in tandem in partnership with our finance team, which was also integrating across 3 regions in the larger healthcare system. And those were kind of the decisions and conversations that formed having those standard operating procedures and governance bodies that we can then use as a blueprint as we started doing more of the technical work.
Okay. And then I want to pivot back to Intermountain. So we got a little bit specifically into data governance there, but could you talk a little bit about how your organization approached data governance and kind of some of that operational standardization and whether it be priorities, or I'm also interested in things that were harder than maybe you expected they would be in that process.
Yeah, I can take that. So one thing that we lucked out on was that our MaineHealth system was bringing their patient data together at the same time. So we were Legacy Intermountain was on Cerner, and Legacy SDL was on Epic. And to lead up to that, they created their own data governance department. And so when we were tasked to create a data governance for the foundation, I was able to tap into that department and get how they've created some of their standards, kind of what their rules were for leading a committee, and kind of the how-tos of what data governance was, combined with what BWF Zuri provided as well. And we brought together, we tried to bring together different areas of our foundation. So we had gift officers to accounting. Each kind of department was represented on our committee because, even though we're the database people, we don't touch everything in the database all the time. So a gift officer is going to use, opportunities and actions way more than I will ever use that information. And so we had kind of, a good group of diverse people, and we did the same thing. We tackled what would make our database consolidation easier. So starting off with the gift standards, and funds, campaigns, appeals. So those were our biggest, hurdles to face right at the beginning, was trying to tackle what we were doing different between our one foundation compared to Legacy SCL's 9 separate foundations, because each, though there was standardization, there was significant differences with their accounting and gift recording standards. So.
Okay, great. And I want to be careful not to assume in this conversation that everything's about the database consolidation, because I'm actually working with an a healthcare organization now that the strategy is they're going to stay on separate databases. So, but I do think a common theme, regardless of whether you stay separate or you come together, is leveraging data. And, that's obviously related to data governance too, but it's also closely related to reporting, and the need for executives to be able to look and make decisions off of that data. So my question is, and I'm gonna call on MaineHealth again, because I know this has been a bit of a challenge at your organization, is specifically around the expectations versus reality. So so especially if you're not on the tech side of this, the organization has this vision of how this is going to go, and what they're going to get on the flip side of it. And then there's the reality of what you've been able to achieve. So can you talk a little bit about that and how you've had to manage those expectations internally?
Yeah, and absolutely, Jason. I think it goes back to change can be very, very quick when you're a team of three or even a team of 15. When you start to get into a larger organization, like we've just become a team of nearly 60 professionals, change takes a lot more intention. And you can't change your counting policies or your campaigns, funds, and appeals at the drop of a hat, right? You have to get consensus from your leadership and get buy-in across the organization. And that takes time in a way that I think some of our teams, when they were separate, when we weren't a one MaineHealth philanthropy team, we're able to make those changes very, very quickly. And so I think being honest and transparent with our leadership in particular about what the hurdles we're going to run into and what kind of consensus we need to build in order to implement the change has been really critical for us. I always lean towards the side of transparency. I would rather lift up the hood and let people see, like, this is not good. We have 21 different fields for emails. That's why pulling a list is so hard right now. And I can't fix that, and Courtney can't fix that in the course of a week or a month. That's going to take intentional work over time. And just being really honest and level setting with your leaders and your colleagues, I think, has made a difference for us in change managing this and having them understand the scalability we're trying to face into as we move to one central team.
Okay. And then Brian or Nancy, I think before we move on from this topic of kind of organizational alignment and data or technology governance, could you talk about maybe a decision or decisions that you've had to make that looking in retrospect, have had the greatest long-term impact?
You want to take that, or do you want me to? I'm not sure what he said, but I'll go ahead and take it.
Yeah.
Okay. I think one of the challenges that we faced was Legacy Intermountain had already become a shared service model. So we had already centralized and standardized a number of different foundation business activities, and integrating the 35 SCL Legacy SCL caregivers into a shared service model, which is Intermountain's model. So we kind of didn't have a choice. It's funny, Nina, I think building consensus, we always want to involve people in decisions and, you know, socialize decisions and try to arrive at the best decision. But this one Intermountain ethos has been such a nice thing to be able to point to, because it's the driving force organization wide. So we had already started to develop teams of specialists. And when we began to integrate the caregivers from Legacy SCL Health, they were more generalized. So in 9 foundations, the caregivers in those 9 foundations were really wearing multiple hats. So we had to figure out which of those team members were going to move to annual giving, which ones would move over to gifts and data services, which ones would move over to PM&R, and then standardizing, for example, prospect management, what was a challenge, but we had already committed to doing that. So, big decisions, I think that the big decisions were almost made before the foundation started its integration by saying we're all going to be part of one Intermountain. So I don't know, Brian, if there's anything that you would add to that, but I think philosophically and culturally, that was a big help, and that decision was made outside of the foundation.
No, I agree. The biggest thing was the way our staffing model ended up being, and placing the right people in the right positions. Because just for an example, our data team was, there was a data team in the Legacy SCL, and there's a data team there, and we kind of brought it together. Nancy brought it together under me, and that was able to help unify us while we're going through the database consolidation. We were able to work together as one team versus kind of doing 2 different things, and we're able to align a little more quickly than we would have if we were still working separately.
Great, thanks. So maybe moving on a little bit to some broader technology strategy, and I'll just open this up to the whole panel. Again, noting that this isn't all about the CRM, although that's where we start a lot of these conversations. And I think just for background, everybody was on some flavor of Razor's Edge, Classic, NXT. There were some more modestly sized foundations that were on ETAP or even Excel sheets, but I think for the most part, that was what we were focusing on combining. But there's a whole plethora of other platforms mixed into those ecosystems. So would anybody like to talk a little bit about how your technology strategy has evolved as these alignment efforts are continuing or took place?
I'd like to talk for just a second about data analytics. You had asked about good decisions that we've made that in retrospect have benefited us in surprising ways, but also reporting and transparency, especially for Intermountain and a large organization whose fundraising is divided into 3 regions. I get asked about this a lot. We have incredible reporting tools, and I wish that we could take credit for it on the foundation side. But the credit that we get to take is that we went to the system and badgered the system until the system caved and gave us our own analyst. So we have a data analyst who actually comes from Intermountain's analytics community, but is a dedicated resource to the foundation. So we've had the good fortune of being able to build a whole bunch of different dashboards that report on almost everything at this point. And we've done that because our analyst has been able to map our data from our CRM to the equivalent of an enterprise data warehouse. It's now Databricks, but and then join that information with other information, for example, patient information. And then build different reporting tools or burst reports or dashboards or whatever you call them, which has made reporting so much easier. and it's automated, it's so much more efficient, and we're not spending as much time as we used to pulling reports, this report, that report, combining things, so that has been a big win for us. And again, I'm grateful for the system and the resources that the system was able to provide in this regard.
And Nancy, I think that's why we're paired so nicely today, because we've seen that success at Intermountain, and Courtney is actually the analyst for our team with a master's degree in data science and sits within philanthropy, right? So you all are where we hope to be in a few years, but Courtney often reminds me and is so good about reminding our team that in order to build meaningful analytics dashboards and an analytics program like Intermountain has, first we have to have clean data, and data we can trust and rely on. So I know we'll continue to stay in close contact as we look to move in that direction, because I think it's so important in philanthropy to move towards data-driven decisions and outcomes. And it's exciting to see how the industry is shifting that way, and that both of our organizations are aligned on needing to move in that direction.
Yeah, and one of the unintended consequences and surprises to me has been that having somebody that doesn't have a philanthropy background has actually helped drive data integrity and standardization more than I think we would have. We didn't know what we didn't know, but when you start mapping data, you really start to see where the imperfections are, or right where the errors are, where the messes are, maybe even never mind imperfections, but where the big messes are. And so our analyst was able to ask questions that we may not have been able to come up with, just because of how we look at things from our philanthropy or foundation lens. And so it's great that you have Courtney. That's a big win for foundation to have a dedicated analyst.
I say that too every day. It's great that I have Courtney who's here with us. But Jason, for your question about tech stack, MaineHealth Philanthropy has invested in a kind of a full tech stack review this year. What software is serving us? We're getting ready for a database renewal. Obviously, we've invested in a significant amount of time in merging our databases. But in addition to that, what research tools do we need? We're in the middle of the procurement process for that. Fund management has been a major hurdle for success at MaineHealth and getting dollars into care team members' hands. And we've recently partnered with FundMiner to help our team do both impact reporting and fund management. And I'm excited to see Hillary and Marlene from that team here today. Have been great partners for us. So we're doing a kind of full tech stack review across the board, from research tools to what do we need to invest in support in the future for our analysts and for other members of our team, in order to move away from manual processes into a more automated space holistically.
I do want to celebrate too that the foundation for a lot of that mapping work, while led by Nina, who is a technical expert in that space, was also heavily supported by the BWF team through a formal technology and operations review over the summer. And especially as an integrating system, that was critically important to us to have an outside member come in and evaluate across the system. So there was this really neutral voice that was helping us uncover these shadow databases and these bespoke processes that had just kind of become ingrained in our day-to-day operations, and really shine a flashlight on that probably isn't best practice, and there's other creative ways to do it. So there wasn't, it became less about like us versus them, and they said, we said, and really just focused on the processes. And we're thankful for BWF's guidance and that fundamental first step.
I would also add that, BWF did a similar ecosystem assessment of what we had prior to our consolidation. And so that has been a helpful, starting place. And as we're still in the process of bringing all of our various technologies together. We have a standardized database, we have standardized analytics. We've just now moved to a standard, event application. And, but, we still have separate email systems and separate online giving tools, but slowly we're working to bring those together and see which ones are the best to keep moving forward. But so we're still in that combining process with the rest of our technology.
Yeah. And I know I took a tech stack focus there, but I'm so glad you brought up analytics and analysts, Nancy. And I'm just curious before we move on, were there any additional staffing positions that anyone felt was, I know you did some alignment integration, but were there any other additions there that you found particularly useful?
EWF.
Oh,
They were temporary contingent workers, really, but your team, I think integrating our teams, adding in, there were no real positions that we added through integration. We're on the tail end of a strategic planning process, and as we move into the future, we will add a couple of additional positions. But no, I'm not here to sing the praises of the organization that's sponsoring the webinar, but really the guidance that we were provided, I think we would have been hard pressed to staff it at that moment in time. So we were grateful to go to market and hire the expertise in short order and onboard it quickly and get it working very, very quickly. So I wish we had more people, but go ahead, Brian.
I would say that a first win for you was creating my position and adding a database coordinator to my team as well. That was one of the first things you did with the integration. So I would say that helped bring our data team together and get the right people in the right spots.
You're so right. And I'm so embarrassed that I forgot that was the one position. And let me just also say, one of the reasons for my short-mindedness is that Brian was the genius analyst before I created that position. So I kind of feel like we already had Brian, but you're right. We created a different seat for Brian and moved him over from analytics back to foundation and then backfilled his analytics role. So I beg your pardon. Yes, the director of philanthropy systems took a lot of pressure off of me, and really together we tag team the engagement with BWF. First at a very high level, and then as we began to drill down, more of that responsibility shifted over to Brian for management of the database consolidation. So sorry, Brian.
yeah. Well, that's great. I'm just being mindful of the time, and I did want to ask a few, switch to a little bit of a different topic as we kind of wind down here. But, and again, I'll just open this up to the panel at large. But these projects can be so big, and there's so many moving parts, and there's so many priorities. And just the topic is prioritization, which can include like change fatigue and things of that nature. But you're getting pulled, whether it be events or online giving or reporting or tool integration. Can you talk a little bit about how you've approached prioritization from your different perspectives, and chosen like what, this has to come before this, and how did those decisions get made in the midst of all that chaos sometimes?
We were really aligned early on no disruption to day-to-day operations, particularly around gift processing. If someone made a gift, we made sure that that process was. And I think that's continued to be a foundational piece in a lot of the work we're doing, is making sure that our frontline fundraisers and our very talented program staff don't feel disruption to any of this work we're doing. And from there, it really became, what are the areas that add value? So if it's reporting on a specific function, if it's a really keystone event in an offsite location that we know has high visibility and high senior level touch points, like those, that is a lot of the ways that we kind of pace the cadence of this work alongside the technical pieces. We broke the mold candidly a couple times, and spent a fair time rearranging the different blocks of our original Gantt chart, but I do think it was ultimately successful for both the MaineHealth philanthropy team and the folks running the consolidation projects.
Okay. And so I'll ask Intermountain specifically, like I know we're all concerned about AI as a we don't all know where that's going, but it can include AI or other topics. But what are some emerging trends that you're thinking about today, especially in light that you've got this technology plan in place? Where are some of your priorities lying in the next 2, 3, 5 years?
I think like you said, AI is our biggest talking point right now. So we have several from our programmatic annual giving team to major gift team who are itching to use various AI tools. And so we're looking to see how we can use what the system already has while integrating something new. But the other thing that I mentioned, we're still, looking to bring together the rest of our technology. So our online giving platforms and the marketing, email communications, those we still have not fully come to one system. And so over the next year or so, we'll hopefully be able to combine those into one system and with that bring more connection to our database and more automation. Aligning them together would be kind of the next goal. Nancy, would you add anything?
I think that you've nailed it. I think it's our programmatic giving team, which is our annual giving and events, as well as our fundraising teams. Also, we're looking into AI and ways that it might assist our researchers, our prospect researchers, as well as our potentially our prospect management. So I feel a little overwhelmed, to be quite honest, right now in all that is coming at us, all of the different vendors that are reaching out to different parts of the organization and really stirring a lot of excitement. And, I think that the AI products themselves are evolving as they're doing demos with us. It feels like we look at something one day and 3 weeks later it's a somewhat different product. And I think there's M&A in those companies as well. So I feel like we've got our work cut out for us to figure out how we're going to employ AI optimally. So I'm taking suggestions from anybody who wants to drop them in the chat.
That's great. Thank you. As I navigate back to the PowerPoint, we're going to wrap up with some open Q&A. But I do want to just kind of open it up to the panel. There's presumably some advancement leaders or leaders that are on the call that are kind of looking at these consolidation efforts or in the middle of them. What's one piece of advice that you would give if you were talking to a peer that is looking is embarking on these efforts?
Go ahead, Nina.
Yeah,
I would on the spot.
no, sure. I think that taking, like Courtney mentioned, that full step back and making an evaluation, zooming out to 30,000 feet, and really trying to be intentional about where to start. And like Intermountain MaineHealth and our CDO put a real stake in the ground with, we are centralizing, we are one MaineHealth philanthropy team, and having one shared database. And I think having some of those strategic guideposts that anchor all of your smaller conversations and the tactics of these projects are really, really important. How does this database consolidation align with your overall strategic goals and strategic vision for your team?
Yeah, and I might add from Intermountain's perspective, and I'm kind of thinking out loud here. it's so important to be sensitive when you're bringing different organizations together, or you're bringing people's data together, organizations' data together. I think being sensitive is really important, but I also think that there will be naysayers. There will be people who just cannot get on board. And I think we have had a couple of those people that we've tried to bring along, and and these are people at different levels too, board members or fundraisers or even operations, different business functional areas. And I think that sometimes you have to face that reality and not let the naysayers win, but instead keep your sight line high, understand the goal, articulate the why, do all of the change management things that we're all supposed to be good at, and keep people on task.
I think centralization really makes misalignment more visible within teams and within a larger system. And something that we needed to be really mindful of, because people are proud of the work they did, right? Like it's no one is doing, like, you wouldn't be in this field and you wouldn't be showing up every day if you didn't care about the mission and the people on the other side of this work. So when you are making changes, it's not that we were discarding something that is not carrying forward anymore. It's that we're ready for the next step, and the next step's going to allow us to do our work in a more thoughtful, productive way without carrying some baggage from what might have been even 5 years ago, which could be a lifetime in technology advancements. So really kind of celebrating what had been accomplished and emphasizing that we are building on something greater has been a really productive tool for us.
That's great. Just want to, I haven't seen, I popped over the chat there. I didn't see too many questions there, but correct me if I'm wrong, Lauren. But is there anybody on the call that would like to talk about integration challenges at your organization, or ask any of our panel anything specifically before we get to our final few notes here? Right. We would like to hear from you a little bit if there's things that you would like to learn more about. Friend Lauren is going to pop up a bit of a poll here. If anybody be so kind to get your perspectives on how things that you're interested in.
Jason, while we let folks respond to that, we do have a couple of questions over in the Q&A. There's a couple in there. We just got a new one. That's, are your teams also navigating restructuring and position eliminations as part of the mergers? We are finding that a challenge to morale in our health system.
Great question.
So we, at Intermountain, we absolutely went through that. And it not position elimination as much as health system optimization, right? Which is kind of a euphemism for the same thing, except for it focuses more on identifying duplicate efforts or duplicate positions to be more efficient and align responsibilities. So I would say there was definitely a period of time where morale was impacted by the integration of teams. And there were, lucky for us, there were only a few position eliminations. And in some instances, we were able to put people in different roles, but there were unfortunately a couple of positions that were completely eliminated. So I think, going back to the sensitivity, and Courtney, I really like what you had to say about honoring what was as we bring people together and, trying to shift generalists into specialist positions and up training people, and trying to make sure that the skill sets and experience align. But yeah, that is something that we just had to continue to change manage through. There's obviously no sure way of managing those situations, except for to point people towards other resources, do more up training, trying to replace people in different parts of the organization or within the foundation. So no real good advice around that, except for just trying to be as sensitive as possible.
Yeah, and at MaineHealth, we are not losing any positions as we centralize, and our CDO has made that clear. We're growing as a team, not shrinking as a team. However, like Nancy mentioned, we are moving into an era of specialization. So jobs are going to look different simply because we don't need 9 donor relations people sitting in every local health community. They can work as a team, right? And how do they specialize within donor relations even further? So how do we scale as a team together? And that kind of change is hard. And I really think just trying to do it with as much, like I've mentioned, transparency and sensitivity as possible, because also change as you're working with human resources or with budgets across large organizations, it doesn't happen as quickly as maybe your fundraising leadership would like it to with reorgs. And just trying to show patience and compassion, and again, try to provide as much clarity as possible is what we've done at MaineHealth.
Thank you so much. I am just going to briefly bring up, as Lauren mentioned in the chat, our next webinar, which is Josh Burkholz talking about Giving USA trends and philanthropy implications from the Giving USA 2026 report, which is always one of our most popular webinars annually. So hope you'll tune in for that. And I'm going to end with our faces and thank everybody. If we didn't get to any questions, I think I speak for everybody on the panel that we're all, including myself, more than willing to follow up by email, chat, and answer any additional questions you might have. I can't thank you enough for your time today on this session, and all of you that logged in, many of you on your lunch hour and taking time to spend with us on these important topics. But for myself and the panel, we'll wish you a good rest of the day. And thanks so much again for spending your time with us.